for all of us as we are working in the COVID-19 pandemic. My name is Laura Archer. I'm the Senior Officer for Emergency Medical Services at IFRC, and I'm really happy to facilitate this webinar today. If everyone is okay, I'd like to let you know that it will be recorded so that it can be shared with colleagues who are unable to join us today. If everyone could please mute your microphones, if possible. We can do that for you. I'm just going to mute. There we go. Sorry about that. So a warm welcome. So as everyone is aware, the COVID-19 pandemic, it continues to evolve, and national societies are faced around the world are faced with so many challenges every day, both in responding to the outbreak and also as we try to maintain essential services, one of which for many of us and many of you out there is blood donation services. Quite a few national societies have reported a significant reduction in voluntary non-remunerated blood donation as a result of the circumstances, and this is really threatening and in some places resulting in a severe shortage in safe blood supplies around the world. This is very much a high priority and a concern for IFRC senior management, and we wanted to reach out to you and connect ourselves with our GAP colleagues to have a discussion today about how things are going around the world and how we can work together to make sure that there is sufficient safe blood supply. We will be having a presentation today by Dr. CK Lee, who is the Chief Executive and Medical Director of the Hong Kong Red Cross Blood Transfusion Services. Dr. Lee, he's also the GAP Regional Coordinator for the Asia Pacific region and is also a member of the Asia Pacific Blood Network. So thank you so much, Dr. CK Lee, for taking time to share your experiences with us. Before we move on and start the presentation, I'd like to introduce you to my colleague, Michelle Solak from the GAP Secretariat. And Michelle, if you don't mind, if you could just give us a couple lines about GAP and your role for those who are not familiar with the work that you do. Thanks very much.
Thanks, Laura. So for those of you who are unfamiliar with GAP, the full title of our organisation is the Global Advisory Panel on Corporate Governance and Risk Management of Blood Services in Red Cross and Red Crescent societies. And really GAP is formed to support the establishment of safe and sustainable blood systems. And GAP is principally devoted to blood banking and blood transfusion related activities worldwide. So the types of things that GAP provides ranges from provision of technical advice, recommendations, standards frameworks and reference materials. We also provide tools and resources, and a lot of these are all available on the GAP website. So at the end of the webinar today, we'll just give a little reminder to go and check the GAP website. There is a link to a number of resources, and particularly we've set up a separate page for resources on COVID-related materials. We also provide country support programs and targeted assistance support activities. We provide post-disaster recovery support following emergencies and disasters. And we also provide some support strategies and tools to assist the retention and recruitment of voluntary non-remunerated blood donors. But essentially, we're a network that shares advice, resources and information. And of course, a webinar like this is exactly the type of thing we try and pull people together. So GAP is comprised of 15 members, all of whom are the heads of their respective national blood programs. And today we're very fortunate that we have two of those GAP members with us, and we've got Dr. CK, who you'll be hearing from very shortly. And we also have Dr. Elizabeth Vanelli, who will be participating in the panel discussion following Dr. CK's presentation. And Dr. Liz Vanelli is the regional coordinator for the Americas region. And so, of course, we'll give a very good regional perspective for the discussions today. So that's a little quick intro on GAP. So I think at this point, I'll probably pass over to Dr. CK, unless Laura, you wanted to say anything further.
No, that was fantastic. Thank you so much, Michelle. And please go ahead, Dr. CK Lee.
Thank you. Welcome, everyone. I hope I can do something to share with you what we have learned from the previous infection pandemic and also recently we encountered. So basically, it's our work we experienced since January because we are next to the border to China and we are heavily affected by the COVID-19. So next slide, please. So Hong Kong is a next slide, please. Hong Kong is a very small city, and because it's densely populated, and we have a lot of cross-border activity. When the COVID-19 was first reported in China, we have been affected. So basically, our concern will be on safety because we understand that we have a lot of cross-border activity, and then we're likely to be affected by the infection shortly. So our aim is to how we can manage the blood supply as soon as possible, as enough as possible to meet the patient demand. The question for the public and the donor is they worry about whether they will get the infection during the donation process, either from the staff, from the surrounding, or even when they travel to the donor center. So I just want to share with you what we have learned in the past because we have been experienced on the SARS and also the swine flu. Next, please. Next slide, please. Sorry, go back one slide. So we have been using something that is not common that in other countries, but we have been start using alcohol hand rub for many years because we have very concerns on the bacterial contamination since like late 1990. So around millennium time. So by 2002, we start to use alcohol hand rub. And also we have experienced SARS in 2003. And our staff and donor are used to wear masks during the period of SARS and at that time. And also during the SARS time, we start to routinely check the donor body temperature. This is something you are not used to do at the moment, but we have been doing this. We have that experience help us to overcome the first wave of the COVID-19. Next slide, please. Next, please. Next slide, please. So basically, the picture you saw in the attachment, you see we get use of them. So no public general, even our domestic helper and also non-Chinese people, they get used to wearing masks in the city. So basically, we have been a lot of in place that we have a clean environment and standard precaution, and also in the fifth bullet point here that we also get used to remind the donor because being a small city, densely populated, a lot of donor may have upper respiratory tract infection after donation. So we always remind the donor to report after donation. Next, please. Next slide, please. So we know that it's highly infectious, the virus, and we are uncertain the risk on the safety. But as far as we know from previous coronavirus, SARS, and MERS, we understand that there was no report of transmission. And also, they're not known to have a significant viremia in the asymptomatic person. We know that there's viremia in symptomatic patient, but we need to do something. this is to minimize the risk of transmission human to human and also gain the public confidence. The second point is more important because most people have a worry about they will got infected during the process from the staff from whatever mean they are at the donation setting. Next please. Next please. Next slide please. So the objective is to because our mission is to have ensure blood supply to patient, in particular group of patient that rely on blood product like cancer patient, leukemia patient, and also those patients have an emergency after trauma or traffic accident. So what we do over the last in the January to February is to restore and gain public confidence that blood donation is safe and crucial for healthcare system at any time. And also what we have done is to minimize any risk of COVID-19 infection in the blood donation and transfusion setting from whatever from our donor or staff who can be asymptomatic. That is really important. So they don't understand that we have been doing something to make sure they are safe to donate at our venue. Next, please. Next, please. Next slide, please. So we divide into three sections. One is blood safety. Second is what infection control measure, and also most important are also the communications to staff, donor, and public. Next. Next, please. So basically, we have been doing a lot of things because we are close to the China. We have been changing our policy for a long time. Now, I believe that now you have been using at least 28 days of deferral for anyone with a travel history to this area and also have the contact history. So you see what I highlight at the last slide is any person with a contact history of confirmed case with and also travel history will be deferred. Well, for those with a contact with suspected case, they should not also come for donation until clearance was given. Next, please. For safety-wise, we know there's no screening test, but we have been doing something like remind the donor that is useful, and also we have been understand that if we have the luxury to have a pathogen reduction technology, it can be applicable. But the problem is that we are not covering every blood product. And more important now, like this webinar, is we need to communicate with all our colleagues worldwide because we need to share what we learn, our experience. Hopefully, we can deliver the safe and adequate blood supply for a patient. Next, please. Next slide, please. So this is more important, but it's more special for Hong Kong because we have been anything will be something like wearing a mask. But anyway, we start from the donation process that all the donor must be symptom-free, no any issue. And before they enter the donation venue, they wear masks, and also we have the temperature checks, and also at the time of the entrance, we use alcohol. Ask them to use the alcohol hand rub to clean their hand. That is important. Surgical masks should be worn all the time at the donation venue. But I understand this is a different culture. We are just get used of that. We are comfortable on this. And next slide, please. So we have freely available alcohol hand rub, not only for the staff, but also for donor. As long as they want to use it, we are welcome to use. And the fifth point is also important. Depends on the setup. Some center may have been using a lot of appointment booking. But for us, we also advocated that must be here more important because it makes sure that they have avoid waiting time, minimal stay at the donation venue. And again, the last point is important, not remind the donor not to come in a big group and not together. So social distancing is important and avoid bringing any accompanied person like kid or just their friend to come together, just to make sure that we just want their donation. We respect that, we honor their donation, but we want them to within the shorter time in the donation venue. Next, please. Next, please. So what we are in the social media, we show up this because we want to transform our donor to a safe superhero. Next, please. So this is some picture our donor used to get on the mask. So at most they are two together, not many come together. Next. So environment is really important. We saw some picture because some of the donation venue in the building. So we have a lot of cleaning procedure, disinfection, like the lift lobby, the button, they have been cleaned regularly. We advocate the social distancing as far as possible. If your center is big enough, you space out the donor at least 1.5 meter or preferably at least 2 meter. So the frequency of environmental cleaning is increased. So either through the outsourced staff or our own staff. Some area like the pillow, the arm pillow, the other area need to be disinfected regularly. Because we are indoor, we are ventilated. We were asked to put on our ventilation at the higher speed to make sure the gas exchange will be better because many of our donors wear surgical masks. We provided rubbish bin for them so that if in case they need to change, they should be properly disposed. And also we have, as I said, our alcohol hand rub is available freely at anywhere in the donation venue. Next, please. Next, please. So going back a bit. Uh, So for the environment, as I said, so we also not only clean the environment, we select something that would appropriate. So you can see here we have some example. We use something like a neutral disinfectant cleaner, but anything your infection control colleagues can advise you can be applied just to make sure the environment is clean enough and the frequency should be as frequent as possible. Just we are trying to match at least once every donation, but sometimes if they're more donor, we are busy, we cannot, but try to increase the frequency. So as long as you are doing something like this, the donor will feel comfortable on what you are doing. Next, please. Next piece. So the next slide is some picture that we are doing at the donation venue. You see our staff wearing masks, donor wearing masks, and also they clean the environment donor chair afterwards. The staff used to wear gloves for donate venipuncture. They also get get use of using alcohol hand rub before every procedure. So this demonstrates to the donor and public that we adhere to the highest possible infection control measure. So this is important. So next one. Next piece. So communication, obviously, you understand that we need to maintain the blood supply. So there's several things like we have been communicated through also to with a patient group and also a group of patients that help out for and asking for blood supply to meet their transfusion need. So several messages like blood demand, appointment booking, shortening of stay, avoiding the getting will frequently appear in our handy tips in the social media, whatever channel we are doing. So also you need support from the mass media, television or radio that can help. As long as they understand that blood supply is important to the healthcare system, they will help out to appeal for the advise the public to come back for donation. Next, please. Next, please. So this is something we are put up here because we have a fortunate that we at the beginning we have a lot of case. We are the Department of Health provide us the confirm the case list. We can also check whether the donor the case has blood donation at this asymptomatic phase, roughly around 4 weeks before the diagnosis is confirmed. So make sure that other safety measures are in place. Next, please. So this is I show you because we still although we encounter a lot of suspension of the mobile draft, but if we can work out this with a mobile draft, like this is one of the organizer is really helpful. They help us to put on a notice. I have some staff to help out for the helping us to check the temperature for the donor, make sure they have the can cleaned. We have a notice you see on the top right hand corner that alcohol handbook is available for the donor during registration. And then, of course, we need them to share with the in the social media that they are helping the patient. So these are a lot of props for them to take the picture. Next, please. Next, please. So this is important because we have a lot of things. So now you are facing this. You have a lockdown of the society. Every people asked to stay at home. So there's significant reduce in the public activity, and the organizer are reluctant to offer venue for mobile blood drive, not willing to go out the staff. We are switched to home office work. We have cancellation a lot of scheduled mobile drive. We have school and university suspension, and also more important in the general public and also donor is their lack of confidence and fear of acquiring infection during donation. So we have been thinking of something like we have been have a vehicle to some area that's close to where the donor live, though for them to minimal travel and work on this. But because of the closure of most of the mobile drive, we only rely on the donor center to operate. Next, please. Next, please. So we it's okay this one because we just cannot manage because at the worst time we have a drop in around 50% of our collection, and although the hospital has been cutting down on the non-emergency service, we still have unable to match the demand every day. At the end, we have been appealed for the public, and with that, the message is slightly different because although we have been using the patient to appeal for the blood donation, we need to add on something to make sure that they are safe to donate. The donor need to come in an orderly manner. This is important to make sure that there are minimal waiting, minimal stay in the blood donation venue. Next, please. Next, please. So appeal like as usual, but the message is slightly different because apart from the infantry very low, we need more blood supply. We need to inform the public that we have instituted what kind of safety infectious control measure, and also what we have been asking the donor to make appointment to have a minimal stay in the donation venue. Next. So this is our strategy is maintain operation in the safest way in according to the latest infection control measure and organization policy. Mobilize the public as usual. We ask the regular donor to come back for donation. What we organize are this organizer because they have already canceled their mobile, but they still can able to reach their staff. So we ask them to mobilize staff to come to a nearest donor center, not to a far away, to avoid that. So the aim is to restore and or gain the public confidence that blood donation is safe, no risk of infection will be acquired through donation, venue, staff, even travel. That is all the message we are embedded in our appeal message to the communication with the public. Next, please. So we put our handy tips. This is important, so they know that this is easier to understand. So some cartoon picture that help them to do so. Next, please. The next few slides is showing to you what we have been done. So this will leave it to you later when you have the copy. Just show you the chart, what we have. Next, please. because in late January we have been also have the Chinese New Year holiday, so we are heavily affected. You can see the yellow line, that is 2020 January time, also the time of the Chinese New Year. You see the drop in collection is roughly around 50%. We are at the end by 10 days later, we have no way. Even our efforts has been done. We need to go for the public to do a formal appeal. But the message, as I emphasize, that we need to get them understand what are the safety measures we are in place. That is the very high standard, and also we want the donor to come in an orderly manner. Next, please. So this is about collection. Next one is the demand side. So the demand, you see, because we are in the early phase, the first wave of the COVID-19. So our hospital has been switched over the mode operation. They are suspending non-emergency service. You see, there were some drop in the demand around 20% at the beginning, but at the time about when we have been catch up and has been stabilized in the mid-February, the demand has been coming up. Next, please. So this is a demand to, the first slide is demand to restore the inventory level of both. This is the actual demand. We are able to see that how many unit of blood has been transferred to a patient. So you can see they have a drop, and then when the inventory has been improved, they are improving, transferring more patients. But you can see there has been some drop in the baseline because our health authority has asked hospital to suspend non-emergency service because we are in the battle of the fighting against the COVID-19. Next, please. So the last chart showing you the inventory. You see the drop is quite significant. You see the drop will be around 3 days of tertiary inventory, so it's very low. We usually maintain around 10 days of inventory for the whole tertiary. But what we have done in the end of the February to early March, we are able to restore to the very good inventory. But what I can tell you now, because we have encountered the second wave of the COVID-19, because after the control in the China, we have seen the outbreak in the Europe and in the American side, and many of our students and also people working in that area are coming back. Most of the case we encounter now is imported case, so we have been seeing some difficulty, and the collection has been coming down because the government has also imposing more restriction on the work and also social gathering. Next, please. So I think I will end here with some summary slide, because we have share our experience in the past 2 months, what we have done. So again, one key word here is we need to advise the hospital colleague, because there should be practicing more alternative measure like patient blood management, and also adhere to the transfusion guideline. So because that will help us to lessen our pressure on the blood supply. So I think I end here, and we open for discussion and also question. I think I can end here. Thank you.
Thank you very much, Dr. C.K. Lee. That was very informative. I'm sure many people learned a lot from that presentation. So for everyone to know, we are very lucky. We have Dr. C.K. Lee, who will stay with us for questions and discussion. We also have a very special guest, Dr. Elizabeth Vanelli. Dr. Vanelli is GAP's Regional Coordinator for the Americas. She is also a consultant to the Honduran Red Cross and the former medical director at the Honduran Red Cross National Blood Center. So really some real expertise in the room. We also have Michelle Solak from the GAP Secretariat, as well as Alexandra Brown, who is GAP's Voluntary Non-Remunerated Blood Donation Project Coordinator. So please, let's use this opportunity to ask your questions, share your feedback. If you would like to ask a question or share some thoughts, please just unmute yourself and go ahead. And I will see when you unmute yourself to welcome you in. So please, I leave the floor to the room.
Laura, it's Michelle Solak. Can I just make one further quick comment? Is that okay?
Oh, please do, Michelle.
Sorry, I hope this is okay. I have noticed that we've got one other GAP member who has joined. So this is quite, I'm sort of springing this on her, but I believe we also have Professor Eilat Shinar, who's the Director of Blood Services from Magen David Adom in Israel. So Professor Shinar, if you can hear and if you're willing to become involved in the panel discussion, please jump in to help assist answer questions. And thank you also to Dr. Elizabeth Finelli and to Dr. CK. Thank you.
Hello. Hello.
Yes, please go ahead.
Oh, hello, I'm Dr. Vinelli from the Honduras Red Cross. Hello to everyone. I just wanted to add to the presentation some of the challenges that have been experienced here in the country and in general in Latin America. We have followed basically the same indications, the same challenges. The country has basically been in lockdown for 2 weeks, so no public activities, of course, no school, no universities, and no blood drives. So all the collections have been basically one by one, repeat donors that are willing to participate, and they have been, the Red Cross has to go to their own homes and bring them to the donation site one by one, because the mobility is very restricted. Some of the other challenges that the other blood programs have been experiencing is that some of the Red Cross blood programs in Latin America operate in conjunction with public hospitals. So of course, the possibility of collecting in public hospitals is basically non-existent, and of course the donors, it is very, very difficult to promote confidence of the safety of blood donation if you have to bring the donor to the hospital. So I just wanted to include those comments in order to encourage the discussion as well. Thank you.
Hello, can you hear me?
Thank you very much, Doctor. Yes, please go ahead.
So this is Soraya Amar from Switzerland. I wanted to just maybe share an experience of one of our regions, which is the region closest to Italy, Tessin. They had a very similar situation like Dr. Vinelli said. They are hospital-based blood establishment. And actually what they did, they rented one of the school halls and put out their center into that hall in maybe 2 weeks. And so they had the donors that came back. So this is also a possibility, using a hall outside of the hospital and just taking everything over there and restarting blood transfusions.
Thank you.
Very interesting. Thanks for sharing. Dr. Vinelli.
No, thank you. Of course, that's a great idea, and I'll pass it on to other colleagues. The problem with some of the collections in the hospitals is what I imagine everybody's experience is, that just they're completely swamped and overwhelmed with everything they need to do. So in the Americas, both with PAHO and other organizations, we are using this opportunity to also convey to the two governments and to the national blood programs that that moving away from collections in hospitals is probably a good thing, and that community blood centers continues to be probably the safest way to collect blood and probably the most sustainable one. So that's another point to think about.
Here's Soraya again. Maybe something else I would want to share with you as well from Switzerland is we contacted, when we had difficulties of donors coming, we contacted our health authorities and our public health authorities, and they put out the information that donation was safe. It was coming from the public health authorities, and they also added the question in questions and answers, this frequently asked questions in their public website, where they said that donations were safe and blood transfusions were safe for both patients and donors. So we experienced after and during that opening of canals from their side, we experienced donors also coming back and our stocks getting higher.
Can I make a comment on this previous discussion? Yes, certainly the public health or Department of Health issue that kind of statement will be beneficial and very helpful. About a hospital transition center, and you have been talking about moving to the community hall. This is a very good idea, because as long as we are not in the hot zone in hospital, that will be less pressure to the donor to come for donation. So they are not less worried about this. And in fact, for us, we have been thinking about this in Hong Kong in January, early February. But unfortunately, we have a lot of difficulty to arrange, because it is a very small city. A lot of people were suspect to have a problem, and then that will scare everyone. So we have been relying on the donor center. About transport of the donor, that I heard from China that they have been using this way, because this is the only way to get the donor to the center for donation. Did help out, but the problem is not easy to manage. But certainly, if with the government support on this, that allow them to travel and to drive, or that would be quite helpful. So in short, we also need to communicate with the government and Department of Health on this, to make sure that they understand blood is essential, despite a lot of patients with pneumonia. The blood demand may not be very high, but there are a lot of patients still need blood transfusion.
It's possible to talk. I'm Monica from Ecuador.
Please, welcome, Monica.
Okay, the situation in Ecuador has been almost the same. We suddenly have just emergency blood inventory. So we make our appeal by media, and we inform citizens about our blood sources and about how safe it is to donate. And we offer to make donations by appointment in our fixed sites in Red Cross. And we also offer to go home. But with this campaign, everybody wants to stay at home. We have many calls, many. And we don't have a call center, so it has been difficult having our people working at home, answering the calls. But the fact that I want to ask is that we began to work with groups with our mobile, but we have to go houses to homes. Because the people don't want to get out of the house. So we comply all regulations, as well as biosafety and protective equipment, and specific transportation, and all disposable protective equipment, and cleaning protocols. But working, if we want to a house, no more than 2 donors in a house. and ask the donor to let us know of any immediate symptoms. We don't have too much personnel, so we are doing, as Dr. Vinelli says, one by one. But in this particular situation is in the capital of Ecuador. For example, in Guayaquil, we just have no donors. And in other places, we can take the donor from the house and take to the fixed point. But I want your advice about the way in which we are working. It's like in our country, everything is going, we say it in Spanish, a domicilio, o sea, at house. Food at house, and now blood donation at house. So I want your advice. Thank you.
Thank you, Monica. Is there anyone in the room who has a similar experience or can offer some advice to Monica and the Ecuadorian Red Cross? Thanks.
Hello, can you hear me?
Yes, fairly faintly, so please do speak up. Welcome.
Yeah, thank you for the presentation. I'm Muhammad Hawi from Lebanese Red Cross Blood Drive Coordinator. I just have one question. As you said in your presentation, you are still having public blood drives? Are you still having public blood drives done? And do you think it's recommended to do blood drives in such cases? And also, do you recommend to draw blood from donors at home?
We are not doing the donation at home because our setting at home is even smaller. That will be a lot of difficulty for us. But we encounter complete cancellation of drive for 2 weeks of time, and we lost we estimate we lost 1/3 of the monthly collection for the last 2 months. What we have done now, we have still have occasional mobile drive at public site. Some of the shopping mall, they are not completely locked down because we are in the first phase. We are not doing a lot of complete lockdown. Now we are going to have soon. We still manage to get one or maybe once every 2 days of mobile. That we have using a bigger space and more preparation in the environment, and also set up that make sure that the spacing good enough for the donation. So the picture I show you is one of the really supportive organizers that help us to organize the drive. The drive is just around 1/3 of the usual collection, so much lower the number of donation, but all the precaution they make will pump their staff and the public. Why I show this up, because this is important, because that is what we have done to make sure that it's safe. We have a lot of stringent infection control measure. So this is what we're doing. But we're expecting in the coming day, like you are experiencing now, we have experienced in the early February, there will be complete lockdown of the society and also no more mobile. So it's difficult. To share with you one more thing is because China has been locked down for quite the whole country quite a lot. They have been, what they're doing, they are asking the regular donor to come back, and also they are using a transport to take the donor to the center for donation. So this is one way to overcome, but of course we have to work on the clinical side. Need to have a doctor to work with the hospital to make sure that the demand under good control or not excessive, or they have been shifting the mode operation to less non-emergency service. Otherwise, the healthcare system cannot survive.
Okay, thank you. Thank you.
Can I answer Monica Pasante's question in regards to donations in the house?
Please do. Most welcome.
Okay. I think this is what we've mentioned before. I think that the Red Cross blood programs need to work very closely with health authorities in order to get special permits and dispensations in order to make collection possible. I think that it's very hard to ask of the Red Cross to go house by house and collect the units. It's hard to collect, to bring the donors to the blood center, but collecting them in the house and trying to meet all the biosafety requirements is very hard. So I would ask Monica to go back to the health authorities and try to find a middle ground in how to organize collections that is needed and supply the hospitals.
Okay, answering Elizabeth, when we have the situation of about blood inventories almost get down in 70%, we call the Minister of Health and say that we will only attend emergencies. It's important to know that our Minister of Health is really weak in the blood program, but really, really weak. They don't give us good directions. They are very weak. So what happens to us is something that we don't expect. We call in the media for volunteer blood donors, but we usually offer at volunteer blood donors for apheresis to go to home and take them to our site. And now it's like the message goes, better stay at home, we go to your home. So we are doing very little. We began to do with groups, with our mobile unit, but certainly we are going to work with an apps with a private enterprise, and we could put in this app, I think, we could go home and take you to our site, or we could go to your home. But if most of you advise us to don't do our home, we will try to make a campaign we will go to your home and take you to the site. I don't know if I explained clearly. Probably my English is not so good, but I don't know, Elizabeth, if it is clear.
It is, Monica, thank you.
Okay, I just make sure that the group prefers us, Ecuador Red Cross, not to work at home, but to work in the site. That is the message.
Thank you, Monica. Anyone in the room, would you like to feedback to Monica on your thoughts about working in home and doing home collection of blood versus continuing in the sites?
Monica, CK, I just want to make a comment because you are facing a lot of difficulty. Either you need to go to the donor homes or work at site. My suggestion will be to try to bring the donor to the site rather than go to home, because you are explaining that you have a lot of protection to go to the donor home to get the collection. So with also you understand that we all facing a limited supply of personal protective equipment. So that will be even you collect, but that will be very difficult. I don't know, but to me, I definitely will go to the government to ask them for help on this, because we are part of the healthcare system to supply blood for transfusion. We need to work in a better way to do so. Yeah.
Thank you. And one suggestion for you, Monica, on the chat is maybe a middle solution could be to park outside the donor home with a blood donation bus. Very interesting. Does anyone in the room have this type of experience with mobile units?
Yeah, we have using the mobile unit vehicle to park in the area the donor will be coming with the short distance. We have been using this. So it's useful. Just using that will be much more effective, and also, and at least they can come easier.
Okay, thank you very much. We are doing also but Unite Mobile. For example, in groups of houses, we put our Unite Mobile and take the donors. And I also forget to say that when we call the possible donor, we make a pre-selection. We ask all the answers about coronavirus situation and also the basic questions. So we want to go for almost probably good donors, not just blind to see if the donor will be good or not.
Thank you. Dr. Lee, did you want to respond to that?
I think so. Yeah, it's important because this will be helpful, because you pre-select the donor. Like appointment system, we also can do some pre-selection question on the donor to make sure they are good enough to donate.
Thank you. So I see one question in the chat. Should blood banks have any role in promoting blood-saving surgical practices for the use of tranexamic acid, other practices to reduce the need for blood, for example? I'd love to hear your thoughts on that.
Let me answer a question, because I have been doing this as well, because at the early beginning of the February, I told the senior executive of the health authority that we need to practice on whatever mean to blood saving and also patient blood management measure, so that we can have a lesser pressure on the blood supply. So this is important. You can have from the blood bank or some of the good person in the field that help you to promote this. That is important.
Thank you, Dr. C. Lee. Does anyone else in the room have experience with this particular aspect in terms of blood banks, blood service providers actually playing that role in reducing the need? And if not, is this something that you think might be interesting during these times when we are having such challenges with supply? Over.
In fact, one of the material I sent over to the member participant, that is one of them, the Society of Alternate Blood Management, that will be including information of blood saving procedure or alternative. That would be very useful. And also AABB also advocate on this.
Thank you very much. Now, I do notice we have our Director of Health and Care with us today, Dr. Emanuele Capio-Blanca. Emanuele, did you have anything that you would like to ask or add as we are going to be ending fairly soon?
Thanks so much, Laura. And I wanted to say two things. One, a big thanks to GAP, its member, Dr. Lee, particularly for his time and your guidance to all national societies around the world. This is very precious. We will be repeating this webinar on Monday in order to cover different time zones and provide access to this presentation to as many national society as possible. Thank you very much for supporting this important work. And then I want to thank all the national society that are clearly struggling and trying to respond to this black swan that has really invested all of us over the past few months and is likely to be with us for many months to come. I wanted to share one question with you, Dr. Lee, about the use of antibodies in plasma of patients who recovered from COVID, and wanted to have the latest from you on this, and also to ask if there is any plan to have national societies involved should actually this become one of the tools to fight COVID. Over.
Yeah, thank you. Thank you. We have experience in the past on the use of convalescent plasma in SARS and also the swine flu in 2009. For the COVID-19, China have been collecting convalescent plasma and has said that it's beneficial in some patients. So, but it have not been appear in the literature at the moment. But from our communication with them, they said it is useful. We have been talking about this with some country, European country, and also like you may know that US's New York Center is start collecting convalescent plasma. So for us, for National Blood Service, we believe that we have the role because we have been collecting the blood and also we have been collecting apheresis plasma, that we have the expertise in the collection and also storage, handling the blood product that will be useful. At the moment, I have only suggestion is basically the procedure will be more than the same, except that you have to slightly alter the eligibility criteria that will allow the donor recover and then donate it earlier after recovery. One of the question here is I have to send off some protocol from China that they have been using a full protection during the collection. But in the past, what we have experienced for the SARS and also swine flu, we have just collecting in the usual way, just treating them as a usual donor, except that they are just have to recover from the problem. So we need to cautious on this because from the previous experience of the COVID that some patient may have RNA positive after discharge. So this is the issue. We need to have some expert advice on this from the infection control colleagues. But I really encourage that we should think about this. At the moment, because of a lot of patients that we may not have the luxury to have many donor patient recover, but if the pandemic will be carried on for a much longer time, we need to work on this.
Thank you very much.
Thank you very much. So we are going to wrap up in just a couple of moments, recognizing I'm sure everyone is in response mode. Did anyone have one more burning question for now? If not, or if you, do I hear somebody with a question?
Hello, this is Rana. I have a suggestion, not a question. This is Rana from IFRC MENA, and since we are all facing the same challenge, what do you think of working together on a communication campaign that has two levels? The first level is to draw the attention of the public all over the world of the shortage of blood donation and how crucial it is not to forget to donate blood. And then it goes to the second level, whereas the national societies adapt the message to their own context, whether call for an appointment, whether we are deploying the blood drive, and so on. I think it's now where we have to show our solidarity all together and raise the voice of Red Giant, saying, hey guys, don't forget about blood donation, using the same messages, but then adapting it to the country-specific situation. Just a suggestion that we might need to think about.
Thank you, Rana. An excellent suggestion. And I think that we can take that offline and we can continue to chat about concretely what we can do together. Attached to this invitation, there was a video that was provided by the Norwegian Red Cross, which is a call for blood donation during this COVID emergency. And everyone is welcome to use that video, adapt it, put your own logo on it. So that is one resource that is out there, but certainly we can continue to connect on concretely what would be next steps. I think that's a great idea. So from my side, I would like to wrap things up. I think from my perspective, I found this really, really helpful. And I think if this is helpful to you and folks who have joined and you would like to do something like this again, do reach out, please respond to the invitation. And if you'd like to arrange something again, it would be my honor to be the coordinator and do this again in a little bit of time. As well, it was mentioned we are having another version of this on Monday. We will be honored to have Dr. Cheuk Kwong Lee's presentation again. So you're welcome to join, and I'm sure if you have questions, that would be a great time to bring them forward. On behalf of IFRC, huge thank you to Dr. Cheuk Kwong Lee, to Dr. Elizabeth Finelli, to Michelle and Alexandra and other colleagues at GAP, and most importantly to all the national societies who joined us today and are really working day and night to serve those who need it during COVID. On that note, I'd like to pass over to Michelle Solak from GAP for your final thoughts. And just a reminder, this has been recorded and we will make this available if you would like to share it with your colleagues. Over to you, Michelle, and huge thanks again.
Thanks, Laura. I think you've really just summed the webinar up lovely. I don't have a lot of additional things to say, but I would just like to put another reminder to let you know that there are some resources out there. I know this is an exceptionally challenging time for everybody. Please do go to the GAP website. We have got some resources available on the homepage. You do not need a login to access these resources. So it's just www.globaladvisorypanel.org, and there's a whole page of resources, and they're broken down into different areas. So resources for securing the blood supply, resources to help with donor and staff safety, and then resources regarding blood safety, and also some more of a general nature. And I would also like to flag for anybody who's not otherwise already aware that WHO did release in the last week an interim guidance for maintaining a safe and adequate blood supply during a pandemic, and that is a very good guidance document and resource. So please make yourself familiar with it. It is available through the link on our GAP website and of course on WHO. So just thank you again to our speakers and everybody for being involved. It is a big challenge, but we are all here and we are a network, and blood people, we get things done and we stick together. So it is a challenge, but I'm sure that we're all up to it. So I wish you all the best for your challenges for your own blood programs, but please be sure to contact us at the GAP Secretariat if you do need anything. And thank you to the IFRC for coordination assistance today.
Thank you, Michelle. And I forgot to mention thank you to my colleague, Chika, who really did all of the work to organize this as well. Apologies, Chika, that I forgot to acknowledge you earlier.
Thank you, Laura. No worries.
Have a last question?
Please, Monica, go ahead.
Yes, it's about convalescent plasma. we have been talking, the university talked with us, thinking about doing this, because the situation is we are poor. We don't have many resources for medicines. So I want to know if doctor can share us the protocol from China so I can send it to the university.
I can pass this to Laura. Yeah.
Yes, no
Yeah.
problem.
Yeah.
Yes, you can send it
Yeah.
to me and I will
Yeah.
pass that along to you,
Yeah.
Monica.
Yeah. Yeah.
Thank you so much, doctor.
Yeah.
And thank you so much for your advices.
Yeah. You're welcome.
Wonderful. I think we will close it here. Huge thanks again. And if anyone has follow-up questions, feel free to reach out to me. Again, my name is Laura Archer, laura.archer@ifrc.org. I'll put it into the chat right now, because if you do have questions for the experts that you did not have a chance to ask, or if you're not one to ask publicly, please pass those questions on to me and I'm happy to direct them to the right person. Thanks again.
Bye, everyone.
Bye.
Bye-bye.
Take care
Thank
and
you.
stay safe. Thank you
Bye.
so much.
Bye.
Bye-bye.